Okay, so some of the pros and cons: equally effective as just normal dieting or reducing calories. There's limited research on the different type of fasting protocols. Adherence, sticking to the diet, being hungry obviously isn't pleasant, so that's going to be an issue. What about your social life? Not getting to eat when everybody else is socializing or going to functions and parties. That might be a negative, but there's some emerging research on health benefits of biomarkers and the microbiome with intermittent fasting. There are cases where you want to avoid intermittent fasting altogether. Obviously, it's with people who are taking medication which require food. So you don't want to alter your medication protocol, like people with diabetes, primarily using insulin, etc. If you have a history of eating disorders, that might lead to disordered eating, or it might exacerbate a condition. If you're a growing adolescent, or if you're pregnant or breastfeeding, you want to avoid intermittent fasting.